Our second session for today is sponsored by Regen Medical, and it's going to be delivered by Sylvie Hampton. And Sylvie is a tissue viability consultant nurse and managing director of Wound Care Consultants UK. Sylvie is going to be talking to us this evening about disposable negative pressure wound therapy, and she's going to be available to answer any questions along with Ian Hardman and Rob Lowe from Regen at the end of the session as well. And I hope to be joining you back at that thing. So again, please use the question and answer function to be able to submit any questions.
Hello, welcome to this webinar, which is entitled New and Simple Use of Disposable Negative Pressure, which is sponsored by Regen Medical. My name's Tracy Cowan and I'm the consultant editor of Journal of Wound Care, and I will be asking some questions of Sylvie Hampton, who's a tissue viability nurse consultant at Wound Care Consultants in Eastbourne, about her experiences of portable negative pressure and the NEXA portable device in particular. So Sylvie, thanks for joining us on this webinar.
Thank you for the invite.
So my first question is, just to set the scene about portable negative pressure devices, when and why do clinicians use portable negative pressure?
It has a great advantage when you have a wound that has fluid coming from it and you have to change dressing so regularly. It's a huge advantage to have it going into a container, the fluid, rather than into the dressing where it can stay wet against the skin.
Okay, and so why, for instance, would it make sense to use negative pressure as opposed to a super absorbent dressing if you've got a moderately or even highly exuding wound?
I'm a great fan of both negative pressure and super absorbents. Super absorbents can absorb the fluid. The negative pressure does more. It doesn't just absorb the fluid, remove the fluid from the wound. It also helps to stimulate the wound to heal, which super absorbents can't do.
And why would you use a negative pressure device for a mildly exuding wound?
If a wound is not healing, no matter whether it's mildly exuding or largely exuding, if it's not healing, then negative pressure will help to stimulate that wound to go back into the healing potential.
Okay, and why would you consider that negative pressure is more cost effective than using absorbent dressings for these types of wounds?
Nurses will often have to change dressings daily on some individuals. With negative pressure, that won't be the same. They can leave it for much, much longer because the fluid is being removed from the wound. I'm, as I've said, a great fan of both super absorbent and negative pressure, but negative pressure also has that added advantage.
Okay, can you tell me a bit about the range of portable negative pressure devices currently used in the UK?
I've used most of the negative pressure devices from the start, from the 1990s. There are different ones. There are very large machines that are complex and difficult to use and difficult for mobility. And there are the portable devices, which make mobility a lot simpler. It takes less fluid generally, but that's not a problem because you can always change it. The problem is that most of these devices are complex and most of them will alarm. And patients find that very difficult in the middle of the night when they're on their own and they can hear the alarm going off. It's not only disturbing their sleep, but can be frightening.
How also do portable negative pressure devices vary in terms of their size and the amount of time that they can be left in place?
There are so many different sizes in negative pressure. You can go from a simple dressing up to a very large machine. As I said, some of the larger machines are very complex to use, and sometimes the very small dressings don't cope with the amount of fluid that is coming out of the wound.
Okay. In your experience, how widely used are portable negative pressure devices by tissue viability nurses and also generalists?
I find that negative pressure isn't used as widely as it should be. It's used in hospitals quite a lot by tissue viability nurses and by consultants who have had good experience with it in the past and will often use it on difficult wounds, particularly dehisced wounds. It can be amazing. But it's not used as widely as it should be in places like the community for different reasons.
And what do you think would encourage more people in the community to use it more often?
Something that's simple to use would be the big thing, I think. I think these things can be quite scary. If you're not using them all the time, it can be quite frightening to have some new device to actually apply.
Okay. And also in your experience, what's the general view of the relative advantages and disadvantages of the different types of portable negative pressure systems?
I think mainly it would be alarm. If a dressing leaks, then the alarm goes off, and it can go off several times a night. And we have one of our patients that had had one of these devices on in hospital and actually wanted to refuse to use it because the alarm kept going off and she didn't get any sleep during that time.
Okay. So would you like to tell us a bit about NEXA?
NEXA is a very simple product, and we have some videos to show you how easy it can be to use. Now, this is the box that it actually comes in, the NEXA box, and you can see it comes not only with instructions on use and simplistic instructions on use in this particular card. The bigger instructions are within the booklet. And underneath it, you will see there is a green plastic bag. And when the device is finished, you put it into the plastic bag and it could be sent back to the company, fully paid for, with the address on there, and then it will be recycled. This is obviously the plug that will connect to the device. And you can see it's quite a small thing to use, quite easy to use. Next is the actual device cover that will come. They'll show you how the device is very easy to use. The black box that holds the device comes with an area at the top, and if you can see, the white area at the very top is where you will see that you press the button to start the machine, and all the time that that is green, the machine is working fine. When it is red, it shows you that the device is full and needs to be changed. So it's a very simplistic device. This is the actual device itself, and you can see it has at the top the start button, and on the side it has a popper that you just unpop to open the machine. It's very simple to use, and this contains the actual product that absorbs the fluid. It goes inside that black device, and we will show you how that actually works in a minute.
Okay, so can you describe how you connect the NEXA device to the patient?
That again is very simple. This that's come out at the moment connects, the dressing side goes onto a film, and the popper at the side there connects to another one that goes to the machine, and it's so easy to use. All the carers found it very simple. This black foam is actually open cell weave, and it is very good at absorbing the fluid. You would cut the foam to fit the wound. When it's in the wound and the device is connected fully, it will shrink and go hard, which is what we want because we know then that it is connected. This is the film that goes over the top. You can see it's got a side 1 and a side 2, and when you're using it, you can cut the film to size. You can take off number 1, stick it over the top of the foam to keep the foam in place, and then take off number 2 and then connect that white dressing over the top, having made a hole underneath it. That connects to the machine, and you will get negative pressure there.
So what are the indications and contraindications for NEXA?
The contraindications are the same for any negative pressure, and that would be that you don't use it in the case of osteomyelitis, and you don't use it over top of organs such as the heart or the gut, because that could be quite dangerous.
Can you use it on any volume level, exudate volume?
I would suggest that it's not used on the very high volume, because you would always be changing the bag. But for normal volumes, it's perfectly adequate. And all of our patients coped with it very well, even the one with the large wound, the very large wound that you'll see in a minute.
Okay. And what size wounds can you apply it to?
Preferably it wouldn't be huge wounds. I mean, we did use it on a very large wound and we used it very successfully, but I think it would be easier to use it on a much smaller wound, you know, a normal size wound. And it would be different for each individual and would have to be assessed for that individual.
And how long can it be left in place?
So like any negative pressure, it could be left for 48 hours to 72 hours. I have used it longer by placing a non-adherent dressing underneath the foam, and I've left it for up to 5 days. But generally, most negative pressures are changed within 48 to 72 hours.
And what is the shelf life of the product?
The product is multi-use, multi-patient use, and it has quite a long life, and we didn't have any problems with needing to change the product during our use of 4 weeks.
Okay. So, in your view, what were the aims of the designer and manufacturer when they were developing the device?
Well, obviously, I'm not part of the manufacturing team or anything like it, but I understand that the aim was for simplicity of use and for not to alarm, because that is one of the biggest problems that patients face is the alarm. I know that there would be concerns that there are no alarm, but there shouldn't be, because the machine goes on working, which is unique to it compared with other negative pressure devices. It would go on working even if you had a leak in the dressing.
Okay. And what sort of training is required when giving it to generalist nurses for the first time, or even carers? We wanted to know that it was simple, so we actually gave it to a carer, and I have a video of the carer trying to put it together without any instructions, pre-instructions.
I'm taking a picture of me. I'm not sure whether this is just going to sit on here, because that doesn't seem right.
No.
It's going to have to go. Oh, I see. Okay.
You need the bag inside. So what they say is put it in like a letter L, or a letter T.
So you're quite right with
where that green thing fits.
Mm-hmm. Probably how I think it will go. Straighten that up so the bag's flush.
Well done.
Close the lid. And then that sits around.
At the top.
Yeah, if you look at the top, you can see whether it's on or off.
You press the green.
You press the green
to switch this on or off.
Yeah.
Press the green to start.
Press the green to start. That's it.
Now your next test is
to get it inside the bag.
Okay.
Easier said than done, isn't it? No, this has got Velcro sides, so it should be okay. She says.
So the imprints.
That way round. That's not fit as well as I'd like. It's got to squash that tube somehow into the hole. No, try it a different way, huh?
You should see through that top.
You should see the on-off button.
Okay.
Through that, okay.
Wrong way round.
Does that help? Wrong way round. Mm-hmm.
It's the only way it'll do up.
It's the only way it'll do up.
And you've done really well.
And you've done really well. Now this healthcare assistant and the lady gave permission for me to use this particular video, and that healthcare assistant hadn't seen it being used before, so she came to it completely blind, and I think she did extremely well in that case.
So what settings can it be used in?
It can be used in any setting because it's a mobility one that the person can mobilize with. Very easy to use because you can either hang it on your belt or you can hang it on the side of the bed if somebody's immobile. So it's can be used in more or less any setting.
And what have the patients themselves said about their experiences of using it? What's their overall opinion of the product?
Well, every one of them did well with it. Every one of them did not want to have it taken away at the end of the evaluation, and we did leave it with some. The lady who had been in hospital using the large machine that alarmed all night was delighted because her wound went on healing and she wasn't disturbed during the night. The machine itself the device was very quiet, very easy to use.
And how long have you been using the device for?
Been using it for quite a while now, and I can't remember the time that I actually started this, but it has been over a good deal of time, and you know, a good number of patients.
Okay, so would you like to talk to us about your own clinical experiences of using NEXA?
Yes, certainly. We did a 4-week evaluation, which means on 4 patients, which means that these patients were supposed to have it for 4 weeks. Some of them actually had it for longer, and I will talk about that as we go through. This is a poster that was produced for Wounds UK conference in 2019, giving the full description on the actual piece of work. And it can be obtained from the company should anybody require it. The first case was an 84-year-old lady with multiple sclerosis. She was actually refusing food, so her wound was going to be difficult to heal. She had a very long-standing pressure ulcer that developed on the ischium while she was seated, but we managed to actually heal that. But unfortunately, she developed another pressure ulcer over the sacrum, which was of 3 months duration. We applied the dressing in 2019, June, which was obviously a year ago. And by June the 17th, the wound had decreased to such an extent that we had to stop the use of the NEXA. And you can see the lady here. This wound was very sore, very difficult to heal. And you can see how quickly it went on to heal. We actually applied some of the black foam we cut into strips with a groove in the middle because she had very delicate skin and we felt that it needed just a little bit more protection from the actual tubing. She never had any problem at all. The next case is an 89-year-old gentleman who had aplastic anemia. He had a wound on his leg which was present for months and was not healing. He actually did extremely well, and his wife managed the wound without any difficulty at all. We would go in once a week, photograph the wound and make sure that everything was all right. During the time that they were using it, they didn't phone us once to say that they had a problem with actually applying it. And the wife applied the dressing, changed the bag in the machine. She did it all completely independently without any problem. And you have a photograph of them in the bottom here, both the gentleman and his wife, and they gave permission for us to use this slide in this case. The next case is a 65-year-old lady who lived alone in her home. And one evening she attempted to stand up, but she fell on the floor and she couldn't stand again. And I can't understand why nobody went to see her for 5 days, even though the family were phoning her and weren't getting a reply. They didn't go and check on her for 5 days. Eventually her son broke down the door and managed to get into her and found her with a massive black pressure ulcer on her sacrum. And she went into hospital where VAC was applied, and she actually did quite well, but it absolutely drove her demented because it kept alarming all night. And one of the problems is if you have a wound on the sacrum, sometimes with the groove in the natal cleft, you get fluid that goes up underneath the dressing there, and it lifts and makes the dressing leak, and then it alarms. And when she came into a nursing home for recuperation, we offered her the NEXA, and she thought she was going to refuse because of the alarm. When she found there wasn't an alarm, she was delighted and agreed to the actual evaluation. Now you can see here, this is the huge wound, and I could actually feel bone in there. And there was 5 centimeters of undermining, and that red area was undermining. So this was a very, very big wound. You can see here that it's considerably healed to the original wound, and the undermining had decreased considerably. When she reached here, again, you could see it's decreased even further, the wound. But the problem was at this point, she ended up having to go to hospital with a heart problem. And so we had to discontinue at that point. But we actually left it with her for much, much longer than any of the others because this wound was so extensive. We felt it would be unethical to stop using it at that point. This is a very easy dressing to use, and you can see here some of the tricks we've used. Here is Duoderm across this area, and what that would do is the film can be placed over the top of that, and you won't get that leak underneath. You can see the foam in place, and when you put this dressing over the top, you actually make a hole in the film, put this dressing on, and then that black foam will shrink down so that you can see that the negative pressure is working. The experience was really good. We thoroughly enjoyed using it, and it really is very simple to use.
So what do you think was the key difference that NEXA made for all these patients?
For the patient themselves, I think the fact that it doesn't alarm is good, particularly in the one lady who had experience of that. But the fact that their wounds, which were non-healing before we started the NEXA, and they could see the considerable difference after we started the NEXA, I think that was the biggest thing for those individuals.
And how could you reassure patients that it was safe with the device not to alarm?
There really isn't any problem why we would need an alarm when the dressing goes on working. It's as simple as that. You know, the other negative pressures, if the alarm goes off, it means that the dressing isn't working and needs to be attended to. But with the NEXA, it will still continue to take the fluid away.
Okay, and how did the patients and their families self-manage with the device?
Well, every single one had either a relative caring for them, a paid carer, or were in a nursing home where generally they are looked after their wound by carers. And every single one managed extremely well. I had no problems with one single one, not one problem.
And you said earlier the device is multi-patient use. How can you guarantee and assure sterility between patients without the risk of cross-contamination?
Well, the dressing is obviously single use, but as long as it's cleaned with the isopropyl alcohol wipes, then it's perfectly legitimate to use it with other people, exactly the same as the other machines that are used.
Okay, so final question. How do you think other clinicians or other centres could make best use of this device?
I think they need to consider more about negative pressure and the advantages of negative pressure. I think there needs to be a bit of pressure put on them to understand how simple it is to use. I think that's the biggest problem for carers and others, is how difficult something might be to actually use. And if they know that it's simple and that the alarm is not a problem, then they would use it more.
That's great. Thank you so much, Sylvie, for telling us about your clinical experiences with this product. Thank you again.
Thank you.
Thank you all. That was really, really interesting. There's been lots of questions in the chat and lots of questions in the question and answer section as well. And I think asking the team, Sylvie and Ian and Rob, can you just say a lot of people have been asking about what's the patient's view on this as well, how they found it. Are you able to give any feedback on that? Especially, I think, with the lack of alarming sometimes. And I know Sylvie's just spoken about it's the fact that the dressing is still in place. But how do you know it is still working? Because even though alarms are very annoying, they do alert you to the fact something's not quite right.
Hi, Karen. Yes, I can answer that one for you. So the idea around the no alarms was we wanted the product to continue some of the therapy or some of the wound management, irrespective of whether there was a leak at the wound site. So we've done this with the novel technology that we've used in the NEXA device. And essentially, if there's a leak at the dressing and you lose a vacuum levels, then the product will continue, and it will continue to still pull the exudate away from the wound. So this was a key issue that we wanted to continue with, because what we've seen and our feedback is if there's a leak in a home or in a care home and the product wakes the patient, typically the patient will turn the device off, or actually when it's alarming, it will stop therapy anyway. So that's the worst of both worlds, really. You've got no pressure, but you've also got no fluid removal. So you're getting a build-up of fluid overnight, sometimes underneath the dressing, and that's causing secondary maceration to the peri-wound area. So we thought, okay, we may lose the negative pressure, but as long as we can keep fluid removal going from the wound, then that will prevent any continued breakdown of the skin.
Ian, as well, a lot of the other questions we're talking about the staff, and it's interesting to see that a lot of these questions are from the UK and from the States and from other countries as well. It's been the same thing that's coming up about education, that they're saying they would love to use negative pressure, but in the past there's been a lack of support from maybe tissue viability teams or GPs. Can you just give a little bit of a feel of what sort of support people would get if they thought, yes, I want to use an NEXA device?
Yeah, no problems. So Regen Medical, the UK distributor for the device, and they have will offer full support to all the TVNs on the product. We're obviously a smaller company than some of the competitors. The benefit of that is we can react a lot quicker. The device has been designed for this in mind. It's so simple to use. There's only one button. There's no alarms to confuse the patients. It will just carry on working until the dressing is changed. We offer inside the box kit, there is a quick start guide. Regen Medical have all the videos on their website of how to assemble the different parts, how to apply it to the wound, how to change the fluid container. So it's really clear. We try to be as clear and public with the information as possible. So hopefully,
and Karen as well.
Managed to.
Sorry, and Karen as well.
Sorry, Rob. Yeah.
Anybody that's obviously interested in using and evaluating the device, we work with them to understand what it is that they need in terms of support, and we roll out a program that's suitable, to meet the needs of the clinicians really, and make sure the patients are supported. So we're flexible in how we do that, and we tend to take the lead of the clinician and build a program accordingly.
I think that'd be really useful after we've read all the comments. And one of the other ones as well was people I've noticed have been talking about Pico a lot, and cost as well.
Oh, we've lost it.
Yeah. Yeah, I think it was around relative costs again compared to other disposable devices, and some comments around that were coming in the questions.
I think I'll let Rob answer that one if you could.
Yeah, I mean, NEXA is obviously a very new device, but in respect to other disposable devices, it is extremely cost effective. On the NHS supply chain, NEXA is listed at £300 currently for the device, which is an 8-week multi-patient device, and a box of 5 dressings is £95, and a box of 5 fluid containers is £95 as well. So that's the typical price. Carry cases are available extra as well.
Okay, thanks. I think one of the other questions is a very specific sort of practical question around the pressure levels and the relative battery life of the product. I was wondering if you could just summarize that for us. And obviously, I suspect there's more information on your websites, but just to finish off, if you could tell us a bit about that.
Yes, so battery life, a full charge battery will last for 10 hours. You can use the device while it's charging as well. If you are using the device and you want to charge it up, it takes 4 hours to fully charge. If you wanted to go and have a shower, bath, and have a rest from it, then if you turn the device off, it would fully charge in about 2 hours. So the pressure levels, the pressures aren't dictated by the device, they're dictated by the dressing. So we have 2 dressings. One is a minus 125 millimeter mercury dressing, and another one is a minus 75 millimeter mercury dressing. And these have been selected basically on the clinical evidence, and obviously talking to clinicians and TVNs about their ideal pressure levels that they use.
That's great, thanks. I see Sylvie's back with us. You might have had some problems connecting.
I
was wondering about, I mean, you talked a bit about your, people's clinical practice and that sort of thing, but I was wondering if you had any feedback from the patient feedback and any sorts of comments around how they've found it.
Every single one found it an advantage. Every single one would back its use because they all had such a difference in their wounds, and it was all so easy for them to manage. So each one of them was pleased with how we used it.
Okay. And I think one of the other questions was around use in infected and sloughy wounds as well. Any sorts of advice there?
Well, I think it's like any wound. If it's infected, it needs to go to the GP. If it's clinically infected, people get muddled with clinical infection and colonisation. In colonisation, it's perfect, but clinical infection, it really needs to go to the GP to discuss antibiotics.
Okay. I see, Karen, you're back with us as well.
Yeah.
So were there any other questions that came up? You were keeping an eye on the chat while I was going through the Q&A.
There is one really interesting question from Christine, and she said, can you comment on use in feet because of weight-bearing activities?
Yeah, I think that's a little bit difficult because you've got a very, very thin tube that would, if it was underneath the foot, that would obviously be stood on. So I think that could be difficult. It would have to be an individual selection on the individual person. We could also look at something like I did with that lady with a piece of foam and a groove cut out of it to lay the foam strip in to take off the pressure. But that would have to be based on the individual. It's not something I could tell you would be solved here, I don't think.
And Sylvia, I think that's really important, that it's all about assessing the patient properly at the beginning of the intervention and regularly assessing them as well, and not just thinking that one product or one device can manage everything. You need to look at the patient, look where they live, and look at the wound, and especially if it's infected or non-infected.
Absolutely. And if something isn't working, whatever the dressing is, if it's not working, it's not making a change, why do we go on using it? You know, it's good old Einstein's theory of madness, isn't it? To continue doing the same action, hoping for a different outcome. So if it's not working, we stop using it. But if it's working, then, you know, it's important that we continue with it.
Yeah, and I think it is all about its regular evaluation, checking you, and if it doesn't work, then look for something different. Try not to stick with ritualistic
Absolutely.
practice of I change it every Monday, Wednesday, Friday. But what's been nice that Ian and Rob have both said is about bespoke education and being able to access the education online, which makes it open to everybody.
Absolutely.
Barbara?
I think we've covered the questions, so I'd like to obviously thank everybody for joining us this evening. Again, guys, there will be more information. All the sessions are being recorded, so they can be go back into, but again, they can be shared. And also more information will be available on the websites of the company as well, if you want to know any specific questions. We will go through and address any of the other questions that have come through. At the end, you will receive, as I said, an email asking you for your evaluation, and we do appreciate your feedback and any comments that you have. I know you've been submitting them through the chat as well, and I would like to encourage you to, again, join us tomorrow for another sessions. We'll have 2 more speakers, 2 more sessions starting at the same time tomorrow. Karen, anything else you wanted to add?
No, just want to thank everybody very much for attending and for engaging really with these online webinars, and thank you for joining us internationally as well. It's really nice to see our international colleagues, because patients who have a wound need managing wherever you are in the world. A wound is a wound and needs to be assessed and have the correct intervention with evidence-based practice. So it's really nice that everybody's chatting in the chat box as well. And I've really enjoyed it. And I hope to see everybody over the next 4 nights as well. So thank you very much.
Thank you, everyone, for joining.
Thank
See you
you.
tomorrow.
Thanks.
Thank you.